The Provincial Opioid Addiction Treatment Support Program Education and Training Pathway for physicians and nurse practitioners to prescribe opioid agonist treatment medications. This video provides an overview of the education and training pathway and each of the steps involved. There are three key components to the education and training pathway for prescribing opioid agonist treatment medications, completed one after the other. 1. Complete the POAT online course. 2. Complete the relevant preceptorship workbook. 3. Attend an in-person preceptorship with a Bccsu approved preceptor. Let's take a closer look at each of these components. In the POAT online course, there are 4 different education streams available depending on which medications you are looking to prescribe and the setting. Buprenorphine naloxone, oral opioid agonist treatment medications in community settings and acute care settings, injectable opioid agonist treatment. There are 3 workbooks available depending on which medications you are looking to prescribe and the setting: community, acute care, injectable opioid agonist treatment. The number of days for the preceptorship depends on the medication you are looking to prescribe. For oral opioid agonist treatment medications, either for community or acute care settings, the preceptorship is 2 half-days or 1 full day. For injectable opioid agonist treatment medications, the preceptorship is 1 half-day. There are several steps involved in completing the education and training pathway. Complete the required modules in the POAT online course. The required modules depend upon which course stream in the POAT online course you are completing. Obtain a certificate of completion in the POAT online course. Be sure to save this when you access it in the online course, as you will need it for later on in the process. Select a Bccsu approved preceptor. Preceptors are available across the province. A reminder that a list of approved preceptors is provided upon completion of the POAT online course. Contact the preceptor directly to schedule a preceptorship. The preceptorship must be with a preceptor approved by the Bccsu. Complete the appropriate workbook either on paper or electronically. Bring the completed workbook to the preceptorship. As part of the preceptorship, you will review the workbook together with your preceptor. Attend the scheduled in-person preceptorship. You may need to complete additional learning at the discretion of the preceptor. At the end of the preceptorship, sign the Safe Prescribing Agreement with your preceptor. The Safe Prescribing Agreement is found at the back of the workbooks. Complete the online preceptorship form. The link for completing the preceptorship form, along with further information, is found in the workbooks. You will also need the following to complete this form: college ID number, MSP billing number, copy of a government-issued ID, copy of the POAT certificate of completion, which is obtained from the POAT online course. Once these steps are completed, the preceptor will complete a preceptor review evaluation, sent to the preceptor via email, and submit this to the Bccsu. The next steps depend on which opioid agonist treatment medications you are looking to prescribe. For oral opioid agonist treatment medications, the Bccsu will issue a proof of completion letter, which is sent via email to both the prescriber and, for physicians only, the College of Physicians and Surgeons of BC. Nurse practitioners do not need to send a copy of the proof of completion letter to the BC College of Nurses and Midwives. The proof of completion letter includes information on how to order the controlled program prescription form pads. For injectable opioid agonist treatment medications, the Bccsu will send you a Collaborative Prescribing Agreement, or a CPA. Complete and sign the CPA. Return this to the Bccsu for signatures. A reminder that the completed CPA must be returned to the Bccsu. Returning this document elsewhere will cause a delay in injectable opioid agonist treatment prescribing, where these medications will remain inactivated in PharmaNet. The Bccsu will process the CPA, which involves authorizing it and then sending it to the Ministry of Health to activate injectable opioid agonist treatment medication prescribing in PharmaNet. Once processing is complete, the Bccsu will send a fully executed copy and confirmation email to the prescriber. After obtaining your completion email, prescribers may continue prescribing opioid agonist treatment medications in perpetuity as the letter does not expire, excluding direct follow-up or disciplinary action from the relevant college. There are no further educational or administrative requirements for opioid agonist treatment prescribing. However, as with all medical care, prescribers are expected to continue their medical education and stay up to date on the best practices and clinical guidelines. For further information, visit the Bccsu website, and if you have any questions, take a look at the frequently asked questions.